Today I'm going to talk to you about energy drinks and their effects on the body. I'm Shana Mayfield. How many of you start your day off with an energy drink or end your day with an energy drink while trying to stay awake for a dental coloring book assignment? I bet a lot of you answered yes to that question. Today's presentation is going to cover some of the contents of energy drinks, talk about energy drinks and their effects on the body, and discuss how energy drinks can affect the teeth. A few energy drink ingredients include sugar and caffeine. The allowed amount of sugar in a day is 50 grams. The amount of sugar in an average energy drink is about 18 grams per serving. The allowed amount of caffeine in a day is 400 milligrams, and your average amount of caffeine in an energy drink is somewhere around 120 milligrams. And I did those averages based on a Consumer Reports article that studied 27 energy drinks and the sugar, caffeine, serving size, and calories. And I just added them all together and did the average for those. And in this presentation, I'm going to focus on only 12 of the 27 energy drinks just because they are common to our area. They're things that are going to be in our vending machines, in our gas stations, and at Walmart. So, how much sugar is in your energy drink? As you can see, these amounts range anywhere between 0 grams of sugar all the way up to 58 grams of sugar per serving. So if you find your favorite energy drink, hopefully it's one of the lower ones. If not, maybe you should consider one of these other options. Read the label. You need to do the math on the serving size, the amount of sugar, and if you look at this container, there are 2 servings in this can of energy drink. And then there are 27 grams of sugar per serving. So 27 times 2 is 54 grams of sugar in one can. And as you'll remember, we just discussed that 50 grams of sugar is the recommended dietary allowance of sugar in a day. So if you have 2 of these per day, you have already exceeded your recommended dietary allowance, and that doesn't include any of the food that you eat. It doesn't include fruits, candy, anything else that you're going to consume. You've already met that all in one place. So you've spent all of your sugar allowance in one place. So now we're going to look at the caffeine in your favorite energy drink. And the caffeine goes anywhere between 6 milligrams and 242 milligrams. And that's a lot of caffeine per serving. The last ingredient we're going to discuss is acid. And the most common type of acid in energy drinks is citric acid. And citric acid, as you'll see, is found naturally in lemons and limes and oranges or any of those citric juices. But it can also be man-made by fermenting sugar. It's used in energy drinks to flavor, to give it a tolerable taste so that you would like to drink it. So now that we've talked about the contents, let's talk about what those ingredients can do in the body and what systems can be affected by the ingredients in energy drinks. And it's going to affect your digestive system, your urinary system, your circulatory system, your nervous system, your endocrine system, your skeletal system, and your integumentary system. And for right now, we're going to focus on these top 5, and we're going to discuss the last 2 skeletal and integumentary systems toward the end of the presentation. So, energy effects on the digestive system. According to a continuing education course, The Truth About Energy Drinks, written by Denise Webb, PhD, registered dietitian, in Today's Dietitian magazine, the caffeine found in energy drinks can cause digestive problems such as abdominal pain, nausea, and vomiting. And the increased amount of caffeine in energy drinks can do just like a cup of coffee can. If you don't eat with a cup of coffee, sometimes it'll aggravate your stomach. That's the same thing that happens with these energy drinks. So, how does it affect your urinary system? The same journal article in today's Dietitian states that energy drinks can cause hypokalemia, which is a deficiency of potassium. What happens is the body's electrolytes get out of balance when someone ingests too many energy drinks. The body will try to excrete the excessive items it doesn't need, and by doing that, if it's getting rid of the things that it doesn't need, it's using things it does need to transport them out. So your electrolytes get out of balance while your body's trying to maintain your homeostasis. Your body is just simply trying to use your urinary system to get the increased unnecessary items out of your body to get you back to optimum operating level. Your kidneys just trying to get you back to homeostasis. And as we talked about the electrolytes in your urinary system, we're also going to talk about how those electrolytes can affect your circulatory system. The electrolytes in the body directly affect your circulatory system. They can increase or decrease your blood pressure. Your heart can be extremely sensitive to the ingredients in energy drinks. People can experience arrhythmias like palpitations, ventricular fibrillations, and ventricular tachycardia. So your heart can either increase its rate, it can change its rhythm, it can experience quivering, and excessive energy drink consumption has also been linked to sudden cardiac arrest, resulting in death. The FDA has pages of reported adverse effects. Now, with that being said, when the FDA gets an adverse effect report, all that means is that someone has called in and said, this energy drink made me feel this way, I went to the emergency room, this, that, or something else. But what it doesn't say is, did the patient consume the energy drink with drugs or alcohol? Does the patient have an underlying cardiac problem or medical condition that could attribute to this? This is just very basic reporting and what someone thinks happened when they took an energy drink. So after not finding a whole lot on that, an article written by 3 doctors, Goldfarb, Tellier, and Thanasuli. And this journal article is found in the American Journal of Cardiology and specifically discusses documented cases involving the link between cardiac problems and energy drinks. These doctors researched hundreds of journal articles in medical databases for cases of adverse cardiac effects in direct relation to energy drinks and their consumption leading up to this event. They started with 657 articles that were relevant to their research. By removing articles that were duplicated, unrelated, or did not have any acute adverse effects or simply didn't have enough supporting details, they narrowed down their focus to 7 articles. These articles revealed 17 cases of people ranging in age between 13 and 57. They encountered some kind of cardiovascular event after consuming energy drinks. Some of the symptoms and side effects were easily remedied, and these patients returned to a normal sinus rhythm. Others resulted in emergency surgeries or even death. So here we're going to look at the nervous system. Although energy drinks claim to make a person more alert, full of energy, and increase their focus, there are some adverse effects on the nervous system. Energy drinks can cause anxiety and nervousness. The Truth About Energy Drinks states that caffeine intoxication can occur with the excess consumption of energy drinks. Caffeine intoxication can eventually lead to shaking, seeing things, cerebral edema, altered consciousness, and even the risk for a stroke. And if you look at caffeine intoxication, it's similar to alcohol intoxication. Some of those same things can be found in patients who suffer from alcoholism. The endocrine system. Energy drinks can affect the endocrine system because of the amounts of sugar in them. Excessive amounts of sugar can lead to obesity. Obesity is directly linked to type 2 diabetes. When you consume energy drinks for an extended amount of time, it can lead to insulin resistance. Once your pancreas is no longer releasing insulin when the blood sugar is high, you can potentially develop diabetes. How do energy drinks affect the skeletal system? Well, they do that by affecting your teeth. Energy drinks and their side effects on the teeth. Here we have a picture of a tooth with some severe decay. In Chapter 13 of the Modern Dental Assisting textbook, it says that sugar is one of the primary causes of caries. Sugar is how bacteria is sustained. After the bacteria digests the sugar, it produces an acid. The more energy drinks are consumed, the more likely it is for a carious lesion to develop from large quantities of sugar. Energy drinks' effect on the teeth continued. Acid is as dangerous to teeth as sugar and bacteria. The pH of saliva is around 7.4 on a scale of 1 to 14. When an energy drink is consumed, the pH of the saliva is lowered. If lowered to below 5.5, the enamel begins to dissolve. Some energy drinks have a pH of under 3. That puts the pH of the mouth under 5.5 very quickly. As you can see, our water is a neutral at 7. And then as you go down to juice and coffee, alcohol, soda, then you'll see where energy drinks land. Energy drinks' effects on the tooth enamel. Citric acid that we talked about in the beginning of this presentation is used for flavoring and preserving the energy drink. The citric acid strips away the enamel right off the tooth. Once that tooth enamel is dissolved and gone, it cannot be repaired. It's irreversible. Study on energy drinks and enamel erosion. Dr. Jane from the School of Dental Medicine at Southern Illinois University was the lead on a study conducted to research energy drinks and enamel dissolution. This group tested 13 energy and sports drinks on pieces of tooth enamel. They submerged the enamel samples in each energy drink for 15 minutes and then stored them in an artificial saliva 4 times a day for a length of 5 days. After that time, the energy drinks removed a lot of tooth enamel. How long does it take you to consume an energy drink? Do you drink it in 5 minutes? Over an hour? Do you sip on it all day? Constantly soaking teeth in energy drink keeps the pH of the mouth below 5.5 for a long period of time, resulting in loss of enamel. It takes 20 to 30 minutes after you consume an energy drink, not after you sip it, but after you are completely done and you've not had any more, for your mouth to return to the neutral pH after drinking a low pH energy drink. Okay, so let's look at a hypothetical situation. If someone drinks an energy drink, they're going to have increased sugar intake. That can lead to obesity. They can become insulin resistant. They could also develop diabetes, which is going to affect their immunity and going to cause them to have poor wound healing. And that poor wound healing is going to make it harder for them to fight off things like periodontal disease. So they could end up with periodontal disease in this chain of events. And I'm not saying that if you have an energy drink now and then that you're going to get diabetes and periodontal disease. But if you drink them on a regular basis and you consume large amounts of them when you do, some of these things are potentially risk factors for someone who does that. So everything is okay in moderation. You don't want to drink excessive amounts of sugar. You don't want to drink excessive amounts of caffeine. That's with anything in moderation. So with this presentation, I hope that you're more aware of the effects energy drinks have on your body. And we've talked about a few of their contents, their effects on the body and the effects on the teeth. And I just can't believe how amazing it is that the things that we consume can affect almost every system in our body. So hopefully this finds good use in your life, and have a great day.